Good evening, everybody. It's 8 o'clock, and welcome to today's episode of Marvelous Medicine. The topic is effective leadership skills for doctors. The speaker is Dr. Ramkumar Venkateswaran. He is on the board of trustees and the chief medical officer of Mission Smile, a not-for-profit organization that does cleft lip and cleft palate surgeries free of cost. Dr. Ramvid is MBBS, DA, and MD anesthesiology from Diplo Pondicherry. He served the Department of Anesthesiology of Kasturba Medical College for 32 years and retired as the head of the department. Dr. Ram started the first BSc Respiratory Therapy program in India. He was the founder director of the Medical Simulation Center at Manipal University and was the founder president of the All India Difficult Airway Association. The IDA guidelines are considered one of the best in the world and are quoted even by international faculty. Dr. Ram has more than 25 publications in national and international journals and served as editor-in-chief of the journal Airway for 5 years. Thank you, Ram, for readily accepting to do this session.
You're welcome, Vidya. I'm more than happy to be here because I've been following Marvelous Medicine over the last 3 years, and great opportunity for being a part of it this time. Thank you to Vidya and Patta.
Moderating the session will be Dr. C.S. Rajan. He is an emeritus consultant surgeon in Martha's Hospital, Bangalore, and a senior consultant surgeon at Anna Swami Mudaliar General Hospital, Bangalore. Dr. Rajan did his MBBS from St. John's Medical College and MS Surgery from Bangalore Medical College. He was previously the head of the Department of Surgery and the course director for DNB studies at St. Martha's Hospital, Bangalore, where he served for over 32 years. Dr. Rajan has received the Distinguished Medical Teacher of Excellence Award of NDE and ANBAI, Lifetime Honors of Karnataka State Chapter of ASI, and Jewel of ASI. He has authored a book called Fact and Fun in Surgery, a companion to surgical study in 2021, which is a mix of surgical information and humor. Dr. Rajan conducts quiz shows which have information, competition, and entertainment. Thank you, Dr. Rajan, for readily accepting to moderate this session. Over to you, Ram.
Thank you, Dr. Vidya, for that introduction. And just to cut a long story short, is that it is really a pleasant surprise to be in the same panel as Dr. Ramkumar, because we are childhood friends. We grew up in neighboring extensions and then we attended the same school. So I've been following and he's been following me for a long time. And honestly, in the 30 years, we never met seriously. And now we are having a chance to see each other and talk. So I find it a fruitful invitation that I am also going to have a lot of pleasure in attending personally. So thank you very much. I suggest that Ram will talk and give us his version of the story. The chat box will be open, and to make it more interactive, I request the audience to type in their queries or comments. And towards the end, Dr. Vidya and I will take each of them and address it to Ram, or we ourselves will be able to chip in with appropriate responses. So look forward to a really interesting session. Ram, I know you're going to smash the stage. Go ahead.
Good evening to everybody, and thanks, CS, for being there today to moderate a session. And thanks also to Vidya and Patta. As I mentioned earlier, they've been doing a great job in the last 3 years. I don't know how they keep unearthing new topics and new speakers. And it's been a marvelous journey following Marvelous Medicine over the last 3 years. And some of the non-medical topics that they have covered over the last 3 years are also very exciting. And Vani and I, most often together, or at times Vani on her own or me on my own when I'm on a conference somewhere else, we've been listening in on these Marvelous Medicine sessions. And hats off to both of you for doing a great job. Before I start, I just want to make sure that I'm seen, because here I've got a particular option on the screen where I'm not seen. And CS wanted to follow all my expressions, and I'm sure one of you can confirm that I'm seen. I'll go ahead.
Yeah.
Yes,
Okay.
yes.
Right. So, the topic for the day is actually effective leadership skills for doctors. And essentially, I think this can translate into effective leadership skills for any profession. And when I, started looking at this topic, I realized that is this topic only for people who have been in so-called leadership positions, or can it be applied to every single doctor who is attending this session today? And I thought it's more applicable to the second category because every one of us who has logged on today has been a leader at some time or the other during our professional career. Some of us have been leading institutions, some have led departments, some have led a duty team when we are on duty together. And even at the postgraduate level, at times we've had a senior postgraduate and a junior postgraduate working together, where the senior postgraduate takes over the leadership role. So there are enough and more situations in our profession where we are given the leadership opportunity more often than not. And how we have dealt with this is probably, I think, what I will speak about in the next 30 minutes plus or minus 5 minutes. And most of what I'm going to say is common sense stuff. Uh, Much of this is learned by sitting on the hot seat as head of the Department of Anesthesia at Manipal. And, I was there for practically half my career in Manipal. I was heading the department. So I have kind of tried to summarize all the mistakes that I have done and hopefully other leaders will not make. I've also emphasized some of the things that I probably did right. And also many of the skills that we'll be talking about today, all of us have role models, okay? Irrespective of who we are, we have role models within our department, we have role models outside the department. And we try to imbibe whatever skills they have so that overall we become a well-rounded individual. So with this introduction, I thought I'll go on to my next slide. And this slide says, in your mind's eye, what skills should a leader have? And this round figure in the middle is not to mesmerize you, but had this been a face-to-face conference, this would have been my audience question. I would have asked people to stand up and tell what skills they would think a leader should have. But since that's not possible in a meeting like this, as CS suggested, as our moderator suggested, you can put your suggestions, your ideas onto the chat screen, and at the end of it, we'll address it together. So, when you look at any profession, today we're talking about doctors as a profession, we all need to look at two different types of skills that we need to possess, the technical skills versus the non-technical skills. And the technical skills of a medical leader are probably the most easy ones to summarize. Irrespective of which field of specialization you are in, you should have, as a leader, you should display knowledge in your area of specialization. You should be well above the others in your team as far as knowledge of that particular area of specialization is concerned. And looking at proficiency in skills that are relevant to the specialization, again, that's very important too. Not just enough for a leader to be good in theory, they should also practice what they preach and they should practice it the way it should be practiced. And therefore, being proficient in psychomotor skills, that is essential in our specialty, is also very much a technical skill that a medical leader should have. The third one I think is very important because a lot of us tend to remain stagnant at the level of knowledge that we learned a few years ago. But I think as a leader, as a medical leader, you need to show that have the ability and the interest to remain updated in a chosen field. Now, sometimes it's not possible. We specialize in certain areas of surgery or certain areas of medicine, or even certain areas of anesthesia for that matter. So it may not be possible for us to keep ourselves updated in all the branches of even our chosen field. But at least what we practice is something that we should be really very confident about. And finally, if you're not very confident of what you have been called upon to do as a doctor, one should have the honesty and the humility to stand up and say, no, I'm not good at this, but I do have somebody in my team who's really good at this, and hand over the responsibility to that person. So I think this is essentially a summary of all the technical skills that a medical leader should have. So I think what we need to do, I'm sorry, yeah, uh, these technical attributes are most often imparted to us as we graduate through medical school. All our teachers have been excellent, and each time, I mean, not a single day goes by when we were practicing medicine, both Vani and I, and even now, when we talk to our patients who were our patients in yesteryears, we very often talk about what we learned from our teachers, teacher X, teacher Y, teacher Z. There's so many things that we have imbibed from our teachers as role models, and I think we carry on that legacy, and that's, I think, important to continue to be good in your profession. Now, what non-technical skills should a successful leader have, and why do these non-technical skills become so very important for a leader in any branch of medicine? It doesn't, it's very easy to understand that if you're a surgeon like CSR or Patta, you have to be good at surgery. And or if you're an anesthetist like some of us on this group, you have to be good at what you do. But the non-technical skills, I believe, is what sets you apart from other peers in your discipline. And I think that's where we need to, concentrate in the next 20, 25 minutes or so. Now, this is a clutter of various uh, skills that one should have as a leader. I will not spend too much time on this, but some of this may be already on your minds, and we will talk about this as we go along. The other thing I thought that I would emphasize was the position from which a leader should lead. What should be the position from which a leader should lead? Now, by convention, we believe that a leader should lead from the front. And there's nothing wrong to think like that. By and large, I think the majority of leaders lead from the front, and that's why they are projected as good leaders. And that's how we picture them as we try to model our lives along the lives of those leaders that we have come across during our medical school days and even later. So leading from the front is probably one of the most common things that happens. And to see here, you have a flock of birds, and apparently, the way this flock of birds is flying actually exemplifies an aeronautical principle. The leader often sets the pace, and the leader often leads the way also. And apparently, I understand that the leader, the leading bird in this flock, as the bird beats its wings down, it basically creates air currents, and that makes it easier for the following birds to follow. So these air currents that are created by the leader actually sets the way, leads the way for the followers, and also makes it easier for the followers to follow what the leader wants to do. You can also lead from within the group. And I love this picture because you have a set of pawns, in the foreground, and you can be a very subtle leader. As the shadow shows, one of the pawns is actually the leader, but you don't have to make it very obvious by whatever means you want to show that you are the leader. So you can very much be a part of a team, and by your actions, by your role models, by the way you deal with situations, you can get it across to your team that actually you're leading from within the group. Well, this is the third position, leading from behind. This photograph was taken with my 6 or 7-month-old granddaughter. I was carrying her in the kangaroo pouch, as they call it. And here I thought that I had full control of the situation. My 7-month-old granddaughter in the kangaroo pouch, and I thought I was completely leading her from behind, but I thought I was wrong. Actually, she was leading me from the front. So, it sometimes is not very apparent where the leader's position should be. And as I've said, you can lead from any position. Which is the best position to lead from? Really, I can't have a proper answer. But I would like to say that those of us on this group today who are athletes, I'm not an athlete, my wife was a very good athlete, but those of us who are in this group who play hockey or football, you know that there are various positions or ways in which the football or the hockey team is arranged, and the leader actually can change position from becoming attacking the opponent's goal or falling back and protecting one's own goal. So the leader's position should be dynamic, which is what I want to say. The leader's position need not necessarily be fixed. It should be dynamic. It should change according to the day, the time, the situation that one is put into, your team is put into, and therefore that ability should be very much a part of a good leader. Okay, now some of the non-technical skills that we will be trying to cover in the next few minutes is summarized by this acronym TEACH. T for troubleshooting, E for emotional quotient, A for active listening skills, C for communication skills, and H for humility. And though this acronym, all of us are taught acronyms and mnemonics to remember things in medicine, I will not be covering it in this particular order as TEACH signifies, but I will be covering it in a slightly different order. So let's talk about the emotional quotient first. Now, uh, all along, most of us, and it's not wrong, we think that a good leader should be very intelligent, and there's nothing wrong in thinking that way. So, but we remember that as doctors, we are dealing with thinking human beings. We are dealing with human beings who form a part of our team, okay, who are also components of the team that we lead. We are also dealing with human beings who are our patients, and therefore, the emotional quotient, acquires a very important dimension when we look at how you as a leader lead your team and how you as a leader present yourself to your patients. And I believe that a person who's high on the emotional quotient with an average intelligence quotient could eventually score over another with a reversed ratio. So it's not necessary that good leaders should have a good IQ. A good leader could be a person who's very high on emotional quotient, an average IQ, they can still be a very good leader. And a good leader needs to also switch between the brain and the heart as the situation demands. Now, very often, it is said that, I should not bring in gender here at this point, but with my wife sitting next to me, I can't but say that, let me put up a photograph that might bring to your minds what we looked like way back in 1979 when we got married in June of 1979. So my wife used to always very cleverly say that I'm the heart of the family and you are not the brain, you're the head of the family. So I don't know what she meant by that. She's sitting right next to me. So she probably thought that I was the head of the family. Maybe the head contains the brain. So maybe she thought that I take the decisions as the brain of the family, and she takes the emotional aspect or the emotional quotient into any decisions that we make as a family. And I think it's very important that whether it's husband and wife, whether it's a professor or an associate professor that works together as a team, whether it's two independent departments that are working together, we need to work like two equal wheels of a cart. And unless we are consider each other equal, then we never really do well as a leader. Coming to the communication skills, now communication skills is itself a very huge topic, but I'll just summarize this in the next maybe one or two slides. We Why do we communicate? We communicate to get an idea across. How do we communicate? Well, days have changed so much now. There was a time when we could only communicate by verbal communication, by oral mouth-to-mouth communication. But now we've got so many electronic forms of communication, which may be good because we can get across information extremely fast. But unfortunately, the speed sometimes becomes a deterrent. And the speed with which we communicate, let's say on WhatsApp or through email, may be such that we are not in synchrony. Our communications, our ideas may cross each other at different times, and therefore the communication goes completely awry in these situations. Of course, there are various types of communication. One of them I've shown here. And what happens if we do not communicate properly, we miscommunicate, or fail to communicate? Obviously, there is a division created between the two people who are supposed to communicate properly. It could be two members of the family. And here in the next slide, I've said poor communication or miscommunication is the most common reason, I believe, for misunderstanding at the workplace. And I would like to change the statement by saying it's not necessarily misunderstanding at the workplace, but it's probably both at the workplace and at home. Now, as doctors, we have various types of relationships within the team, between teams, we work interdepartmentally. And at home also, there are so many different relationships that we build up, between parents, between our generation, between the next generation. And all these links have to be created very carefully because a little slip up on any of these the lines of communication can really mess up things. I believe that good communication is a glue that holds teams and families together. And we always emphasize that there should be a closing of the loop of communication. When we say something to a colleague of ours, the colleague needs to get back to us saying that, okay, I've understood what you have said, and I will do it this way, so that we know that what you wanted as a leader has been done by your subordinate. Coming to the third aspect, which is active listening. So there is a difference between hearing and listening. And this is a picture of me with Dr. A. Krishna Rao. Dr. A. Krishna Rao is a very famous physiologist. For any physiologist on the group who is logged in today, I'm sure he is a giant figure in the field of physiology. He was the dean of Manipal Medical College from the time it started in 1953 for a very long period, for 27 years to be exact. And I joined a few years after he gave up his deanship, but I interacted with Professor Krishna Rao so many times as he was part of the medical education department. And I really consider him the person who taught me the difference between, hearing and listening. Dr. Krishna Rao was known to be a very, very good administrator. And all he did was active listening, as he told me himself once. So, what is active listening? Very often, what happens when your team member comes to you and wants to present a problem to you, we often hear the problem, but we don't internalize it. So, given here on this slide are the 7 key active listening skills. And I'm not going to go through every one of them, but if you have somebody come to your room, you're heading the department or you're heading a unit, and one of your colleagues comes to your room and wants to discuss something that went wrong, I think the first thing is turn everything on your table upside down. Whatever you're looking at, whatever document is, put it upside down, put your cell phone away, relax, sit in a relaxed manner in your chair and look directly at the person who's come to speak to you. Be attentive, be all ears, I would say, to what he or she has to say. And intermittently ask some open-ended questions just to know that, for your colleague to know that you're actually listening to what is happening. If required, if something that your colleague is saying is not clear, you could go on to point number 3, which says asking a probing question. You can request for a clarification if something that is being said is not very clear, because we don't want to be discussing a problem that has not been understood properly by both the parties that are discussing it. Periodically paraphrase what's happened in the last few minutes so that we're all on the same page. Be attuned to and reflect the feelings. See, somebody may come to your room very agitated. It may be, no, I'm an anesthesiologist, so it may be an anesthesiology colleague of mine who was wronged by a surgeon, let's say, wronged by a surgeon. Something happened in the operating room. So he or she wants to vent out the anger to me, but I need to be able to absorb all of that so that when that person leaves my room, he or she leaves in such a way that they can go back to the same surgeon and we work with the same surgeon in a compassionate manner. And finally, we need to summarize all these meetings. So this is the difference between just hearing and listening. When you hear a problem, we need to put in all these elements of active listening so that at the end of it, you have listened to a problem. And Dr. Krishna Rao, as I showed in the earlier picture, you to do exactly this. You go to him, speak to him for 5 minutes. He may not give you a solution straight away, but you would feel that yes, he has listened to you, and you actually come out of the room feeling very lighthearted, as if half your problems have disappeared. So we talked about 3 non-technical skills till now: emotional quotient, the importance of how EQ is as important or more important than IQ, importance of communication skills, how things can go wrong in communication nowadays especially, and active listening skills. Coming to the next point of humility. I put in a picture here of Dhoni because I believe he was a very humble leader on the field. And his leadership quality was that he had the capacity to translate vision into reality. And he was, again, one of the leaders who could actually change position depending on the needs of the team. He could even, bat higher up as one of the openers, one position, one, two, or three. The team demands it. He would most often come in the middle order and stabilize the way the team is functioning. Or if required, he would come towards the closing overs, depending on the format of cricket that you're playing, and then release his powerful shots and win the game for you. So Dhoni was one of those people who could actually effectively lead the team from front, from within, and from behind. So I thought I should put up this picture. And he was one person who believed that, together everybody achieves more, which is actually the starting letter of each of these words spells out the word team. And to the left of this screen, you can see a huddle, which very often we see on, sports grounds. But this is something that we need to do, if not physically, at least mentally within a department, within a team, so that we are all on the same page. We need to know where we stand in the team and how and where we can bring in our views when it's required. I brought in a picture of my family because I thought we are meeting on this forum after many, many years. And this was a photograph taken of Vani and me with our 4 grandchildren. Karthik, my elder son, has two girls, the girl in yellow top and the girl sitting to her left, a long sleeve top. And my younger son, Krishna, has 2 children, one sitting to Vani's right, the elder one, our granddaughter, and the grandson, the one who came to upset the balance. And we called it 3:1, 3 granddaughters to 1 grandson. So another aspect of the team is that the team is only as strong as its weakest link. And none of us in the team would like to be the weakest link, I'm sure. Right? We all want to be a very strong link. We do not want ourselves to be the reason why something fails. So, therefore, I think as long as the team understands what is required of the team, and we play all our roles well, you may play a role as a doctor, as a nurse, as a technician. We all know our jobs, and if we do play our job to perfection, then the chain will be strong and will never break, and we'll achieve what we want to achieve as a team. Now, this is again a very favorite slide of mine. It says true leaders don't create followers, they create more leaders. Now, we have in our mental eye, we think that leaders have to create followers. You have a picture by which you have somebody leading the team and 100 people behind that person. That gives you the impression that that person is leading this group of 100 people. But I think what's more important, and which is what I think very humbly, what I try to do in my department is that I try to create more leaders. All of us have the ability to identify the strengths in our members, and we need to promote these strengths in each one of us. And more importantly, we need to find out who is going to be a good successor to us. And this is what Dhoni did to perfection. He created reliable future leader. I don't need to identify the 3 famous cricketers on this slide. They've all been very much, are still very much part of Indian cricket, and all of them have led the Indian cricket team very creditably in their times. So this is what a leader should do. A leader should identify the next leader who should be taking over the reins from you. And that brings us to the point, when do you hand over the baton? Now, the baton should be handed over at the right time to the right person. Okay? So I believe that, the system of rotating headship that happens in departments has been a great thing that has come up, because there's a lot of people standing in the wings, a lot of people standing in the sidelines who have the ability to lead the department. But just because of the earlier rule that, once you're head of the department, you continue till you die or till you retire, was the rule earlier, that really didn't give the opportunity to everyone in the team to play the role of a leader. And I think this handing over the baton to the next in charge, your duty as a leader is to create that next leadership, is a very important aspect. Now, recently, Vidya and I met at Alleppey, and this visual came up to my mind, the snake boat race. Why did I think of this? So those of you who are familiar with this, the snake boat race in Alleppey, which happens in the Punnamuda Lake, knows that, this is a very long, slender boat. And every member in this team is important. And as you can see, In the main part of the bone, you have of the board rather, you have one, two, three, about 9 people standing up, who probably are section leaders. And right at the back of the board, you have 5 people who are standing up with larger oars, and they are the overall supervisors of the whole situation. So here is a team where each section has got a team leader, and there's an overall leader. So several leaders take a position before the race, and what is the job of each of these leaders? They need to make sure that they are all rowing at the right time, in the right direction, so that as a team, they achieve what they want to do. And that's what's happening here. The independent team leaders are blowing the whistle and making their segment of the rowers row at the right time. And the people right at the back are actually having their rows off the boat. They are waiting for the right time to stabilize what is happening. If something goes wrong, they are the overall leaders who will jump into the picture and bring stability to the whole team. So, what are the lessons learned for a potential leader in the medical profession from the snake boat race? Leaders need to take up several crucial positions, and an overall team leader literally takes up a vantage point from where he or she has a supervision. I've intentionally hyphenated this. It's either supervision or you can read it as supervision. So a leader should have an overall vision. Finally, we come to the last point, conflict resolution. This again was taken 15 days ago when my younger son, Krishna's 2 children, were fighting over the binoculars. We were on the terrace of our house early morning, and I took my grandchildren up to the terrace to show them birds. But my grandson, who was only 3 years old, was more interested in the binoculars than the bird. And my granddaughter was more interested in using the binoculars to watch the birds. How did I solve this conflict? All I did was, you know, I knew I was my grandson's favorite, so I just whispered into his ear, give the binoculars to your sister. I will show you the birds directly. And he became docile immediately, and you can see how quietly he's watching the whole situation now. Both are happy, right? My granddaughter is happy she got the binoculars. My grandson is happy that I'm going to be showing the birds directly. So essentially, I used some of my skills to resolve this conflict. I'll end with this, 10 rules, 10 simple rules, or 10 commandments of conflict resolution. Um, Again, this is to lend some scientific content to my talk. Most of what I've said till now is basically from my own experience or from watching my seniors run a department, run a show, be a leader. But from this point onwards, I'll be presenting 10 commandments of conflict resolution. Conflicts can happen in our life, okay? Uh, our idea of any leader is to, one, make sure that conflict don't arise. That's a tall ask. But if conflicts do arise, as a leader, we need to make sure that they don't go out of hand, they don't go out of proportion. And a small proportion of these conflicts will go out of proportion. And at the end, I will try and suggest what we will have to do, or what this article talks about, what we need to do in a situation that things escalate to such a situation that there's no looking back, there's no coming back to that situation. So there's an answer to each of these three situations. One, prevent a controversial conflict situation from arising. If it arises, how do you take care of it? How do you defuse the situation? And if things don't happen as you really want things to happen, what do you do? So the first of these says always treat people with equality and respect. I think this is something that a leader should know. A leader should command respect. Leaders don't demand respect. And I think the leaders who demand respect will very soon fizzle out of this situation. But those who command respect, who command respect by their way they act, by the way they behave, by the way they, create a role model, they will be the true leaders. So treat them with equality, treat them with respect. Every member of your team has his or her own experiences to share. So keep ear open, actively listen to what they have to say, and treat them as your equal. Seriously consider and respect other people's views. Very often as a team in a medical college, we work with people who come from different medical schools, from different states. They've had different leaders who have, role modeled different kinds of leadership skills to them. They may have something to add to what you have, or they may have something to say that, sir or madam, what you're doing is not absolutely right. My teacher used to do this. So be open to suggestion and be willing to learn from somebody who wants to say or share their view that maybe what you're doing is not really right. If you disagree with someone, which will happen sometimes, say so, but at least be kind enough to explain why you disagree, because then the other person may understand why you disagree and then may agree with you, or may then argue at a point, and finally, you both leave the situation uh, uh, as good friends and maybe with better understanding. The fourth point that says here is make sure you're on the same page. And this is where I think super fast or lightning speed communication has actually come as a problem for us. Things happen so fast on WhatsApp and emails nowadays that sometimes we are not on the same page. The old method of communication was better, I feel, for some reason, but we have to, grow with times. So make sure that, when you send a WhatsApp message or when you send an email, make sure that you have worded it correctly, you have said what you want to say, and more importantly, you're not saying what you don't want to say, so that you don't upset the person who's going to receive your email or your WhatsApp message. And the spoken word is dangerous enough, but the written word is more important. So, point number 5 here says pause before you press the word send. And this I have practiced very often as a head of the Department of Anesthesia at Manipal. I would get upset with somebody or something that happened. I would type out an email the previous evening. The same evening before I go home, I would type out the email on my department computer, let it simmer overnight. Keep it on the back burner overnight. Come back next morning. First thing, open that mail and read it. See how strongly I feel about it at that point in time. If I'm still kind of iffy, do I send this letter or not? Keep it for another day. It doesn't matter. 48 hours later is not too late. At the end of 48 hours, if you still feel that this is an email that I would like to send, you press the word send by all means. But then you've given your idea due consideration before you send it off. The next slide summarizes the next 5 commandments of conflict resolution. So things will go wrong for sure, but when things go wrong, have the what should I say, the leadership skill to apologize when you do something wrong. I've
Humility.
done wrong. Yes,
I said
please.
humility. I said
Pranam.
humility.
Pranam. Yeah, thank you.
I said,
Humility.
yeah.
Humility to, absolutely. Humility comes first, and then you also, if you don't think that what you have said is wrong, then humility doesn't help, right? So you need to first understand what is wrong. For that, your colleague has to tell you that you're wrong, and you have the ability and the humility, as Pranav put it very nicely, to apologize, so that you defuse the situation, and then you work together as a team again. Engage in an honest, non-confrontational dialogue. All our dialogues should be simple. They don't need to be confrontational. Especially, they don't need to be confrontational just to prove that you're a leader. So I think honest, straightforward, statements made at an eye to eye level, like from an equal to an equal, is more than enough to take us forward and will less often than not create a conflict situation. Now, I've always trusted a couple of people in my department, and I know whom I should turn to if I need impartial advice. Sometimes I feel very strongly that what I've done is right, but then the way things are moving, it looks as if what I've done is wrong. And therefore, I turn to these 1 or 2 people and I say, this is what has happened. What do you think? Do you think I'm right or wrong? So you have to have a confederate in the department, somebody whom you can trust, whom you can find out whether you're on the right track or not. Because sometimes, you get blinded by your own leadership skills, and then that's when things start going wrong, right? So know whom to turn to if you need an impartial advice, and I'm sure all of us have that impartial advisor in your department or your home to turn to, and that's where we need to find our final answer. Last 2 points, very important again. Know when it's worth fighting for your point of view. Sometimes, you feel you're knocking your head against a wall, and all you will end up doing is you get a headache, right? So sometimes you know that what you're fighting for, maybe it's worth the cost, but you know that you're going to lose it at the end of the day. So you may as well stop fighting for it, so that at least you don't raise your blood pressure and you're healthy at the end of the day or at the end of your tenure. Finally, the problem is unresolvable. Distance yourself. This is, I found in this article, it seemed a little controversial to me. And what this group of authors say is that when the problem is unresolvable, let's say you had a conflict in the department, you don't agree with. Yes, please. Yes, Samiran. Can I continue, please? Yeah, I'm just almost done, okay? So if the problem is unresolved or resolvable, what these authors say is distance yourself. Now, it might even mean that if you do not gel well with your team in the department, you do not gel well with the scheme of things in your institution, you may even have to resign from your position and leave the institution, right? Now, that's a very, very difficult decision. And that's why it's the 10th commandment, okay? So in summary, what I'd like to say is that, we talked about what in our mind's eye should be a true leader. We talked about the professional skills that one needs to possess to be called a good leader. We also emphasized the 5 non-technical qualities of a good leader. And the acronym talked about TEACH, T standing for troubleshooting or conflict resolution. E for EQ, maybe equal to or better than IQ. A for active listening. C for communication skills. And H for humility, as Pranav again pointed out. Thanks for that, Pranav. Humility is absolutely essential. I wanted to make a point that a leader's position need not necessarily be from the front. It should be dynamic. There are days when you can lead from the front. There are days when you change position to the middle of the team. And there are also often days when you go to the back of the team and push your entire team forward. You know the strengths of your team. The idea of you as a team leader is to bring out the best in your team. And if you're doing that on a given day, I think you've done your job as a leader. Leaders need to create new leaders. It's not important how many followers I have. I don't need to end the day by saying I've got 150 people, who are my leaders. I don't have to look now. I actually peer to see how many people are listening to me. 104 people. And as I look, it became 103. Maybe, that person got fed up with me. But I don't need to look at the number of people who are following me. I think as long as I create, you know, I take across some point the people who are listening to me. I create a new leader. I don't need to look at how many new followers I'm having. Finally, we finished up with the 10 commandments for conflict resolution. I would like to end with 2 photographs of my family. To the left is Karthik, who was born in Pondicherry, and Karthik's family, Disha, to his left. They are two daughters, our first two granddaughters, and me and Vani when we visited the US. And to the right of this picture is Krishna, my younger son, with his wife Chetrali, and me and Vani with them in Bangalore. Ananya, Kaustubh on the right, and Anushka and Amaya on the left. So once again, very quickly to go through Karthik, Disha, Amaya, Anushka, Ram and Vani on the left, Krishna, Vani, Ram, Ananya, Kaustubh and Chaitrali on the right. And thank you to Vidya and Patta Radhakrishna for this great opportunity for me. It gives me an opportunity to be very much part of the Jubba team. And I think I'll stop here. Thank you very much.
Thank you, Ram. That was indeed a very, very quick and most common sensed approach to leadership that I have heard. I'm deeply grateful to you for your inputs. The fact that you have spoken so quickly, and if you looked at at the chat box, we've had 25 entries which literally match every word of what you're saying. You've talked about confidence, compassion, communication skills, and there are 1 or 2 words which are interesting for us to take note of is someone has mentioned selfless leadership. So that I think is also a very important aspect. One thing Dr. P.K. Sen has come out with is a sense of humor. Now, I believe that we need to look at the things in a lighter side of life, and that little smile, that little welcoming approach of the leader cools down a lot of things before they can even get expressed. So that is a little point that is there. What do you say about the word role model? How do you look at a reader to be a role model?
Right. So fortunately, all of us have or are still spending some time in teaching institutions. And I think that the best way to be a role model is to be very proficient in your subject. Like CS, you're a good surgeon. Obviously, you'll have hundreds of followers behind you because of your good surgical technique or whatever. So we have Dr. Ravi Shankar there. I wanted to say at one point, and I think this is a good opportunity to say that, Ravi, that our batch of CS, our batch of 65 in JIPMA turned out 13 anesthesiologists. That's, that's one
I
out
have
of
7
five.
in my batch.
That's 1 out of 5. I mean, this is actually, I don't mind saying it, at a time when anesthesia was not a very popular subject. So the fact that 1/5 of the class decided to take up anesthesia means, speaks very highly of the leadership of the anesthesia department at that time. And Ravi was one of the junior people at that time. So we had, stalwarts like Dr. Chakravarti, Dr. Kangle, Dr. L.J. Chandrasekhar, Ravi Shankar, and Gauri. These were my 6 mentors, so to say, who actually led me into the field of anesthesia. And I would like to, salute all of you today for having, been my role model. So that answers your question in one way. You have to have a role model in your profession. And if you feel your role model is doing your job well, that will straight away, uh, do wonders. There are, of course, other ways also, like, you could be you could be a role model by the way you deal with your fellow colleagues, way you're approachable, you know. Uh, an approachable leader is always, I think, much sought after because it's going to be somebody who's sitting behind a closed door all the time and you need to be scared to enter that room. You're not going to be a good leader at all. So I think a leader should be approachable. I would just stop with that. Any other thoughts?
My colleague and friend Dr. Punitdar has said humor is great but should be cautious and one should not succumb to sarcasm. And I always am very strict that you do not be sarcastic to create yourself to be funny. You have to be balanced and you should see the proper lighter side of things. Bringing sarcasm is a way of bringing down somebody, which is not the right thing for being a leader. And another question that came up is don't talk behind someone's back.
Rajan, just to add on to that, sarcasm sometimes is a double-edged sword. You know, you mean to be sarcastic, but then it goes down without the other person realizing that you were being sarcastic. Then you get it back from that person, right?
Correct.
So
Um,
yeah.
Talking behind another person's back, that we sometimes, it comes through the grapevine to you rather than directly. How would you deal with such a situation?
Well, Rajan, I read a very nice book on this. This is presented to me by Dr. Murli Sivarajan, who's known to Ravi Shankar, 5 years senior to Ravi's batch. Murli was one of my senior colleagues in anesthesia, and he presented me a book. At one point, we said, how the way we talk affects the way we work. I think that is the essence of a team. How you speak to your team members. And this is an excellent, excellent book. I can send a soft copy of this to anybody who wishes to read it. So I don't know whether it's still in print. But this is something that teaches you that one of the things I want to mention of this book is that, okay, just for mentioning it, let's say I have something against Vani as a surgeon. I need to have the ability to sit across the table with Vani and tell her that this is what I don't think is right about you. Rather than you go talk to X, Y, and Z. Hey, Vani, everybody thinks she's a great surgeon, but this is what I don't like about her. That kind of thing. Right. So this is what you're meaning, I think. Something coming back,
Yeah.
something coming from the back and stabbing you. When you could actually have said it up front. I think the upfront approach is better, CS. It
Yeah.
leads to less conflicts. And I don't think there's any
Eh,
two options to this. Yeah.
Another little comment was that you should always close the loop. When you're a leader, you get an issue and it's not good to leave it open, but you must do your best to make sure that there is a resolution. Just like your conflict resolution, you should
Right.
also close the loop of whatever little affair that comes. And I think that is a very important character for the leader. Any
Absolutely.
comment on that?
I fully agree with that. And I think that this is something that, is very important for team dynamics. Okay. It could mean, for example, as an anesthesiologist working in the operating room or the ICU, at times I may be mentioning or giving orders for something to be done. But if that order is not heard by the team member and it doesn't happen, so I may say, for example, give adrenaline and it's not given, and I presume it is given, that's a crucial mistake. Similarly, I may say, like there's something that, let's say, CSR and we are working on a patient and something goes wrong with that patient. Okay. I think we need to decide when is the right opportunity moment to go and talk to the people outside to say when things are going wrong, right? So I think
Yeah.
it's really important that we actually, communicate the right thing at the right time. That's I think that's very important. Yeah.
The other thing is, we have very clever and smart juniors. And sometimes juniors tend to fire from your shoulder. This is a
Okay.
comment that's come up in the chat box. How would you deal with an aggressive junior who is trying to, fire from your shoulder and issue the order, surpassing or probably not telling you all the facts?
Yeah. Yeah, I fully understand what you're saying, CSR. This is, those of us who've seen Sholay almost 50, 60 years ago have heard of Gabbar Singh, right?
Yes.
Gabbar Singh used to be used, to scare people. If you don't do this, Gabbar Singh will come at night. That kind of thing. So I've had situations where people have misquoted me. People have used my shoulders to fire the gun. Okay, but if I get to know it, I think I would definitely, try to sit that person across the table and find out why he or she did it, and then get the third person involved. Who the salvo was fired at by my colleague from my shoulder. Get all three to the picture and then resolve the situation. That's the best way to do it, so that everybody learns a lesson that you can't do this behind my back.
There's a very technical question here. What's the difference between an operational leader and a strategic leader? Is there a difference?
An operational leader.
Operational leader, that means day-to-day activity. Strategic is probably thinking into the future,
Yeah, yeah. I think see,
having a
operation.
plan for the future.
I think a leader should have actually a good view of both. As an operational leader, you need to look at the day-to-day running of what you're supposed to do. Let's say you're a surgeon or an anesthetist or an intensivist. You need to make sure that what you're expected to do during the day is going smoothly. But then I think strategy, when you talk about strategy, that is what I basically hinted at when you talk about the future of a department. Right. See, when you may build up an excellent department, but for that department to remain where it was when you left it, you need to strategize much earlier. You need to create a second level of command. You need to give that person a chance to basically take decisions while you're still around, so that you can still advise the person. So that is where strategy takes over operation. Operation is purely day-to-day running. You know, once your term is over, it's over. It's completely different where your legacy
No, no,
continues.
I switched off my video.
Okay, Pranam, no problem. Yeah.
It comes down to the next point, that is, which is actually last in the list that is there, but I'm skipping the others. How should a leader fire a person from the job?
From the job.
Hmm.
Well, see,
How do you
actually,
take disciplinary action?
okay, right. Uh, I've had two models of, I've seen it in our own department. I won't mention names here, but I've seen a leader who was very direct about it.
Mm.
Okay, who went out to say, I don't think you're going to be good. You may as well find another job. That's being very direct. I think that's not a great way to do it. But I think in all, I would say that if I find somebody not up to the job, either professionally or otherwise, they may be professionally very good, but they may not be a good team player. So I would slowly start talking to this person if I'm in a leadership position to tell them, listen, these are things that have been reported to me. Please try and rectify these things. And if you rectify, you're going to be a great person, a great asset to our department. But if you don't do that, then maybe you might have to uh, not find another job, but I'll slowly break the news to the person. But see, I would say I'm getting a lot of complaints from people that this is how you're behaving or not behaving right. So I think break it slowly. The bad news I think needs to be broken very slowly, so that and also it should be done by a senior person in a very tactical manner. Then it will be taken well.
How important is it for medical curricula to include leadership courses or leadership talks to us as students? Because nobody teaches us leadership in medical college or even at post graduation. We learn it on while we are in the job or in the saddle. We pick up all these little traits. Do you think it's worthwhile having leadership? And just like we have financials, we have statistics and other things which are important in life later on?
I think
Should
this is
they
a
come into curriculum?
Yeah, I think, the thing is, at a curriculum level, if you're talking about, an MBBS curriculum, people are probably a little too young at that point to realize what they really mean by a leader. You know,
The
they need to
same
be,
thought,
yeah,
yeah,
they need to be put into
same
a
thought
situation
came to me that we are too young for it.
too young for that. So therefore, I don't think part of the curriculum would be helpful. But I think it's important that if you consider yourself a leader, you need to lead by example. And all of us have had role models in our life. And I think whatever the way we have fashioned our lives, the way we practice our profession, the way we practice live our life, is actually fashioned on some person or the other, without doubt, right? It could be within the family, it could be within our professional family. So I think that's very important. And at this point, I also want to say 1 minute, buddy, sorry. I also want to say that how many of us remember some of the ways in which our teachers behaved by the bedside? Bedside manners cannot be learned from a book. Bedside
Yeah.
manners need to be learned by the bedside. And I still remember so many of the beautiful ways in which some of our teachers dealt with our patients. And if you feel it's nice, it strikes you as good, you will imbibe that. And then, it becomes second nature. Yes, Vani, you had something to say.
I want to say that when we were 30 years old, you and I attended a workshop by Sunny Tharapan
Yes.
on facilitating excellence in effective leadership. And it really helped. You asking whether we should be taught. I mean, everything is useful. Like we were not taught so many things in medical college. Now everything is being taught. But that workshop actually really helped me to resolve conflicts with my 4-year-old child or within the family itself. So Krishna, when Krishna was 4, he wants jam, and I would shout at him. So Sunny Tharapan taught us, put jam and put sauce and say jam will give you caries and sauce won't, and he will decide what to do. And I wanted to say this, give this credit to Sunny Tharapan, who definitely made Ram and me better leaders, because we all, he, me, Dr. Ram Narayan, Dr. Guru Madhav Rao, lot of our friends, Dr. Ram Narayan went up to be VC, Dr. Guru Madhav Rao was registrar, and at 30 we all attended this lecture together. And I want to say just one more thing, that C.S. Rajan's role model, dad, C.S., I don't know what he was, David, your dad was C.S. So I know, because Rajan was my role model. He was 2 years older than me. I went for 6 months to my grandmother's house. He took me to his father's clinic. If I'm not wrong, his father was an ophthalmologist. And Rajan taught me to take BP there. And Rajan's role model was his dad, CS.
Right. So we all have role models.
Well, thank you, Vani. That brings back a lot of memories. Ram, there's one more thing.
Yes.
Do you feel that you have more friends outside your department than in your department to trust? When you wanted a confidant, you wanted somebody whom you could share your problem with. Would you find that person within your department, or would you find them outside your department?
Well, actually, I had good friends both within and outside the department. I won't trust everybody. Let me say that up front. Okay. I knew that there were some people who are only interested in the way their career progresses in the department or otherwise. And I won't care too much about their views. So within the department, we had a department that was 36 members strong. I truly respected the views of about 5 or 6 people. Now, outside the department, right sitting next to me is my most trustworthy confidant. Whenever I have a problem at work, I would go to her and we would talk over it at the dining table. And she would give her pearls of wisdom, and very often it used to help me resolve issues. I did have friends outside the department as well. And I don't know whether to say this here, but there was at least at 3 times in my career, I wanted to leave Manipal. For whatever reason, I was not happy with the way things were going, whatever it is. So I went to a surgeon. Some of you may know that person, Dr. PLN Gangadhar Rao. He's a pediatric surgeon, right? So he's still here. He still works in the university. So he was a registrar at that time. So he told me one thing, Ram, take a sheet of paper and you write all the negatives of the institution where you're working now. turn it over, and write all the positives of the institution where you're planning to go. And the list will tell you what you need to do. And on all three occasions, I didn't leave the institution. So
Yeah,
I did have friends outside the department and a surgeon, at that, who gave me good advice. So I think you need to choose your friends very carefully. Ravi, yes, please.
Dr. Ravi Shankar, you want to say something? Hello.
Ravi,
Yeah,
I need something from you, Ravi.
yeah.
You are one of my role
Nice
models.
talk.
Yeah, Ravi.
Nice talk, Ram. I
Thank
just
you.
want to say a few things
Yes.
which I think are important. One is you should talk about honesty, integrity, and accountability. These are most important things for a leader. He has to be honest in whatever he is doing and telling, and have the integrity.
Yes. Not heard. Ravi, you've been,
Ah.
Ravi, you're muted. Sorry. You got muted halfway.
Can't hear.
Patta. Yeah.
Now we can hear.
They can hear you. Just, you talked about honesty, integrity, and then we lost you. Yeah.
Accountability.
Accountability. Okay, right. I was making notes, as I always did. Whenever you speak, I make notes.
because these are three important things. If you have these three things in you, you become a role model.
Yep.
Yes.
Because if a person thinks that you are honest and whatever he's telling you, he's not telling you a lie. The other person thinks you are telling you a lie and you are telling somebody else something else, then you are not going to be a good role model and you are not going to be a leader. See, these are three things I think you have to have if you want to be a good leader. And I will coin another term called emotional leadership rather than emotional quotient. These are two different things.
Okay.
Emotional leadership takes you, if you have these honesty, accountability, and integrity and ethical behavior, you become an emotional leader. That means, and at the same time, you should have the confidence to say that if you know that what you are telling is right, what you are doing is right, you should not bother about the conflict that you are going to produce and get it resolved with the conflict and go ahead and do what is needed, which is good for the team. So these are the qualities I think you should also be emphasizing on to be a good leader. Anybody can comment on this.
No.
Yeah. No, I was just writing it down, and as I wrote it down, I think it was maybe in 2018, I gave the Dr. Fanindranath oration, and Ravi, of course, knows Dr. Fani Tota, and many anesthesiologists on this group also have heard of Dr. Fani Tota. So when I spoke about Fani's credentials, PHANI, I used H for honesty, I used I for integrity, and I used A for accountability. So I used his own name as an acronym to show how this person was a true leader. So I mean, absolutely, I think as Ravi said, honesty, integrity, and accountability and emotional leadership. I'm hearing it for the first time. I just presume, Ravi, what you're saying is that if you've got a good emotional quotient, then you also become a good emotional leader. Not just leading by force, not by demanding respect, but by commanding respect. Do I read it that way? I don't know. Or is it something else?
I think that makes a lot of sense. Yes. There is a little query from Dr. Didipya Devprasad, who says, what will you do if your close friend, he's a leader himself in another department, is nasty with your juniors when you are not around? You sometimes find seniors, colleagues taking their, what shall I say, disappointments out on your students or your juniors. And that leads to conflict between people at your level.
Yeah,
how would you address it? Would you side the juniors or would you go to that senior and talk to him?
I think, like a good judge, you need to hear both sides of the story.
Yes.
So I would probably listen to what you said my junior colleague was offended by a surgical colleague who was obviously at a higher position and a good friend of mine, is what you said, right? So taking that situation, I think I would first talk to my junior colleague get the facts of the case from him or her, then I would speak to my friend. Since he's a good friend of mine, I would say, apparently this happened in your operating room. Is there any truth in it? Find out what is his or her story. And then I would try and actually get everybody, all three of us, into the same room and patch it up.
Same boat, same page.
Yeah, you need to get together. Otherwise, you can't really sort out differences. And you need to be that person who will get these people together. Right?
Like Vani, Puneet also strongly believes that all these things need to be taught at some point or the other. So Puneet, would you like to expand on that? You said it has to be in the curriculum.
Yeah, I think we had raised this in Amrita in Cochin, and our first principal was very keen that it's implemented. I think our MCI curriculum is so tight that there's no scope for change. So I think we do need to make a representation to the NMC now, as somebody pointed out in the chat box as well, that we should have it along with other things like medical humanities and all now. When these things are probably more important. You have an EdCom module, but effectively that's probably even more important. I really loved the whole session because it really echoed what my own life has been, that we've learned on the job and not been trained and done badly first, and then only got better by the time it's no use. So I think I love the way some of the points of good leadership I find is making fun of yourself. Like he looked at the number of people exiting and he said one person has exited. So, the moment you make fun of yourself, you can easily make fun of somebody else, even if you're sarcastic. So I think that's a very important thing for a leader. Always get the other story. If somebody's complained to me and I'm sort of on their side, I automatically judge. But I think it's very, very important when it's not in line with my thought processes to, look at that viewpoint as well. And another bad leadership I see in medicine is, especially very large departments in government sector, is having a fall guy, having a junior act as a surrogate leader. So he's seen as somebody who will tattle on to the boss. So it's very careful, I think very important to make sure that you don't let it appear that you're absolutely non-partisan. There are no favorites, no surrogates, and the head is not there only to collect brownie points. So that's some of and another thing I notice is many people get disillusioned initially if they realize that their efforts are not appreciated as leaders. They care. So I think you should care about those under your care, but don't care if they don't care. So, you still have to do your job, and not merely because you don't get appreciated, you shouldn't get disillusioned. Thanks, Vidya.
So Ram Shivapillai brought up this.
Don't get upset if they don't care. Because you're doing your job. As long as you do your job happily, it doesn't matter if the other person doesn't care. Thanks, Puneet, for all those points. Thank you.
Yeah, so Ram, Shiva brought up the point that most doctors shun leadership positions. Is that what you are seeing? And Shiva, do you want to say something more? Why you made that comment? If you're still there, Shiva.
Yeah, thanks, Vidya. I worked with Mandela, and he was an amazing leader. But his style of leadership, if you asked to describe, is very, very difficult. But the most important thing was that he always said, if you leave a vacuum, and if you are not prepared to stand up and do something when it is necessary to be done, don't cry when somebody else goes there and messes it up. And he felt that if you have capacity and you have the ability to do something, put your hand up and do it. But he always said that most of the time, people who want to do things, those who speak the loudest, or those who are very extrovert, are not the best people to lead. So because they're looking for a position for a reason. But whereas if you have got capacity, and if you think you can make the lives of people better, put your hand up and stand up and do it, because You are needed. And if you do it honestly, that's the most important thing. So, and be decisive about it and go about it, even if it's a field that you are not familiar with. But if you really honestly think you can do something, then you should put your hand up and do it. I found that doctors, when you try to talk to them and to organize them, it's the most difficult group to organize. If you try to say, doctors, let's go and talk. You ever try to say, doctors, let's go on a protest now regarding what's happening in Palestine or something like that about what happened with fellow doctors? They very, very difficult even to wear a ribbon. But you have to force people to say, if you care and you really think you could do something, then you have to put your hand up and do it. But if you do not put your hand up, don't cry about somebody else who is there now who is incompetent. That's all I wanted to say.
Thanks, Shiva. We have Dr. Rajiv Tiwari. One of those leaders like Ram, whom the entire department loves him. So, Dr. Rajiv, we'd like to know your secret of your popular leadership.
Oh, Vidya, I'm driving. In fact, I was on the telephone. I'm taking my mobile along with me. But yes, whatever has been discussed here is fantastic, and they really mean something. For me, is to lead from the front. And my colleagues also, if any problem, one thing is important, that you have a faith in your colleagues as a leader. And if I just think that if somebody is truthful about what is they want and what is happening, then that's the best thing. Then you can just help it out and you can take a charge as a leader. But sometimes it is messed up because of their reasons. Then you have to take them seriously and slowly take out the truth out of that and then solve the problems. But as a leader, you said, yes, interdepartmental, inter-college, in the public, in the society, everywhere you have to think and you have to coordinate with everyone and show your potential. That is most important. I did everything in that way only. I hope I'm audible.
Yes, absolutely.
Yeah, I'm driving, so I don't know whether you're able to listen what I'm saying.
Yeah, we could hear you very well. Thank you, Dr. Rajiv. Please drive safely.
Thank you.
Dr. Ravindran has his hand up.
I'm driving hands-free since it was a very interesting topic, so I joined. Thank you, Vidya.
Thank you so much, Dr. Tiwari.
Hello. Vidya,
Yes.
can I speak? Yeah.
Yes,
I enjoyed the talk. I'm Ravindran. I'm a professor of pharmacology in JIPMER. I enjoyed listening to a talk. Well, what I feel is the leader, first thing, first attribute or first thing, leader has to have is the courage, guts. I have seen people, who are in leadership position, and then they are afraid of signing even a routine file. They're always afraid of something, and they should not. In that case, then they should not take up no leadership position. But then we have seen many people who are taking up leadership position, and then they don't want to do anything for fear of making some mistakes or fear of being blamed or so many things. Number two, a leader should have the skill to delegate. He has to choose right people for certain work, for a project, for work, and then he should choose right people and he should delegate the work. Then only he can achieve something. That is very, very important. As Thiruvalluvar says, இதனால் இவன் முடிக்கும் என்றாய்ந்து அதனை அவன் கண் விடல். That is one of the most important qualities of a leader, because leader cannot do everything. As yourself have said, well, you have expertise or the very, very high skill in only one area of your field, but not in others. So naturally there will be others who have got skills in some other area, and you choose him, and then you give him the responsibility and ask him to do it. I had a chance to I was a dean research in JIPMER for 3 years. Always, I would say I'll do only 2% work. Only first one is 1% is starting it, and the other 1% is ending it. Meanwhile, I choose people and tell them, no, this is a work. You please, no, do it. And meanwhile, no, I'll give this kind of a laissez-faire kind of leadership. That is, you allow them to work, no, allow them to come up with this thing. I mean, the people who are choose you are good, and then they can do really. You have faith in them, they'll do it. And then what you do is, if possible, you participate, or at least you supervise and have meetings. Okay, what you have done, you correct it, and then finally end it. So this way, you can achieve a lot. And there is other, the leadership types of leadership, which I think, I don't know why you have mentioned it. One is dictatorial, and number 2 is participatory. Number 3 is laissez-faire. Dictatorial, well, at times you have to be dictatorial. There is an emergency. You have to say that, no, you do this, you do this, you do this. No questions asked, because that's the situation is such that, no, you have to be dictatorial. There is a participatory, that you participate along with them, you also do the work, and then get the work done, finish the project. Number 3 is laissez-faire. As I said, you choose people who are good at it, very good at it, they are good, very good skills, and then you leave it. You just leave it. Ask them to do it. They will finish it, and then at the end, you can see that you can approve it, and it'll be okay. And no type of all these three leaderships. Some might ask, which one is good? It's all situational leadership. It depends on the situation. You will encounter some emergency. At that time, you have to be dictatorial. You will be something, let us say you want to conduct a conference. You will be also participating. You will others participate. Laissez-faire. There are people who are very good at something, and then you just leave it to them, and then finally you say approve it, and then this thing. Well, these are my 2 cents. Thank you. Thank you very much for giving me a chance to respond.
Vidya, can I say something?
Thank you so much, Dr. Ravindran. Yes, Ram.
Yeah, Vidya, can I say something, please? Yeah.
Absolutely.
Yeah, so Ravi, thank you for that very nice summary. All I can say is that the Department of Pharmacology in Jipmer is in very good hands, because you already identified the second level of leadership. And you don't have to worry, because the day you retire or the day your leadership is over, your department is already in very good hands. So I think this is the important thing that I didn't use the words dictatorial and situational and others. I didn't want to add terms to this, but I mentioned that a leader can and should change position depending on the situation. And I just want to say one thing, it was a very emotional moment for me when I took over from Dr. Patta, the leadership of the Department of Anesthesia at Manipal. It was on the 1st of July, 1995. And I still remember, I entered Dr. Tota's room, the head of the department. We just stood looking at each other awkwardly for 2 minutes. And both of us had kept the HOD's chair vacant. He was waiting for me to sit on it, and I would not sit on it till he left the room. It was a very odd situation, So then finally I asked him, very hesitantly asked him, so funny, as I take over the reins of the department, do you have any advice for me? So he looked at the chair and he said, as long as you don't put the chair on which you sit above your duties, you'll be fine, Ram, he said. What he said indirectly was, don't give too much to the position that you hold. Do the job that you need to do, and then you will be fine. So that was great advice, and I think that's the advice I give to my to go from me later also. Great, thank you for that.
Okay, thank you. Thank you.
Dr. Gyaneshwar, you have your hand up. Are you available to talk?
Yes, sir.
Yes,
can you hear
please.
me, sir?
Yeah, we can hear you.
Yes, please.
Yeah,
Yes.
sir, it was a fantastic talk. I joined a little late. I'm sorry. I just had a question which I faced. Like, we all want to be popular. We all want the work spot to be a very nice place to work in. But then where do you draw the line between being effective as a leader and being popular? Where do you draw the line so that you're not taken for granted?
Okay. Now, see, I think you do not become a leader to become popular, point number 1. You become a leader because somebody has trusted you to lead the situation. It could be a department, it could be, whatever it is, depending on your discipline. So don't confuse the two. You don't take up a leadership position just to become popular. If you do your job properly as a leader, you will automatically become popular. There's no need for you to try to become popular. So basically concentrate on what you need to do as a leader, and the rest of the things will just fall into place. I'm forgetting the second part of your question, Janeshwar.
That was the same. Wait, I was basically asking, how do you be nice to people around you and be effective at the same time? It wasn't more about being popular. It's more about having a nice, cordial relationship at your work spot with everyone. But sometimes you realize that you can't always be nice to everybody because you have to get the job done sometimes.
So let me just say, okay, I've not been a very nice leader. Okay, I've not been nice all the time, and I've had the times when I've been very strict, very upset with some of my colleagues, and I've said it to their face. But actually, they've thanked me for it at the end of the day, right? So it all depends on how much respect they have for you. If they really respect your leadership, and if you lead by example, like for instance, I can only give you the example of anesthesia. You know, as an anesthesia chief between 1995 and 2006. I was the last person to leave the department because I wanted to tell my colleagues that you do not leave a case that you have started unattended. You do not hand over to somebody and leave. So I led by what should I say, being a role model. And there were times when I would tell my junior colleague, maybe an assistant professor, I say X, Y, or Z, you can go home. You've got a young family at home. Anyway, I've got some department, communication to be typed out on the computer. I'll be sitting here. I'll cover your room, right? But then that person turned back and said, "Sir, how can I leave the department when you're sitting there still?" Right? So you can do anything by being a leader by example. You lead. You must practice what you preach. Don't expect double standards. Don't tell somebody you need to do this, and the next day you do just the opposite. Then you lose your credibility. You lose your credibility. Okay.
I think one of the things Yanish was trying to bring out is when you're trying to be nice, you're sometimes taken for granted. And how do you escape the trap? So, your junior says, how can I leave before? From next time they'll say, anyway, you are here, right? You sit, I'm going. Like, that's the reality of
I'd like to take the answer. If you don't mind, Vidya, I'm trying to keep quiet because Rajan or Ram may shut me up. But I have watched Ram lead the department for 20 years, and I want to give the answer. Ram is strict. Like, Ram is not nice. Ram is not. He will not bow down to anybody. Whatever. I don't know how to say it. But Ram is an effective leader. But I could never be an effective leader because I've got too much emotional quotient and I'm too sensitive. And I was never a leader of a department. I was only a unit chief. Maybe I didn't answer the question, but I want to say that Ram was an effective leader because he keeps his emotions in check. And so I was very sad because Ram and I are classmates. And talk about EQ and IQ, my children would say that Amma was Jipma first, my children. And my father would say that my son-in-law came 13th, Jipma 13th, because Appa thought that. But it's not that. You have to have a balance of EQ and IQ. And I think Ram has a good balance of EQ and IQ. That's why he was a leader. I'm totally imbalanced. So one day I was very sad that I was never head of department. I have to keep myself, keep quiet, because I'm emotional. And Rajan may say, time is up, or Ram may say, time is up, because I'm frightened of people. So one day I was walking home when I was 45 years old, and I was thinking, I will never be head of department in Manipal. And our house number was 105 KMC quarters. And I told myself, I'm unquestioned leader of 105 KMC quarters. There has to be just one leader. In my house, I am the leader. In Ram's department, Ram is the leader. Thank you, Vidya, for letting me speak.
Yeah. So Somnath has made the sort of graduation not just leading a department, but actually, opening a hospital and running. That's a giant leap of faith. So Somnath, if you're still on the call, we'd like to hear from you. That's taking leadership to another level, right? Putting the money where your mouth is.
Hi, Vidya. Thank you very much for prompting me to join this. It's been only a second meeting, and the last meeting I joined for 5-10 minutes and then got called away. Dr. Ram, amazing lecture, amazing talk, and amazing follow-up from both Dr. Ram and Dr. Vani. I'm humbled to be in the presence of Ravi sir, the only one person in my life I call a guru. Thank you very much, sir. You've been my inspiration all my life. I know I've taken a huge leap of faith. I do still balance, though not very balanced, do some clinical work and a lot more of admin work. In terms of leadership, what I would like to say is I've always been led by the John Maxwell quotation that says, a leader knows the way, shows the way, and goes the way. And for me, in terms of knowing is the knowledge and the experience. Showing the way is somebody who's able to guide people and push them forward and lead them in the way. And that's the talk component of walk the talk. And the goes the way is the walk component of the walk the talk. I think that's something that's always, and I've tried to live that live and walk the talk every step of the way. What in terms of leadership, I think I can't. I've almost everything that I believe in has been so aptly put in Dr. Ram's lecture, and the additional comments from Ravi sir were amazingly great. What concerns me today is the problems that somebody that in my position I deal with senior doctors, and senior doctors today are, they're a bunch of people who are extreme high IQ, but also have extremely high EQ. Now here, EQ is not emotional quotient. Here it is entitlement quotient, right? They know what they want. Quite often in interviews, we regularly interview, we have about 45 consultants in our hospital. We regularly interview people for positions. They all know very well what they want, what's the position they want, what's the salary they want, what's the hours they want to work. The minute you ask them the question, what are you going to do for the institution? That is what are you willing to do for the institution? There's an absolute silence. Right, and that's what really concerns me. The other thing that really concerns me is I think there is a significant vacuum in the number of leaders who are coming up the ranks. It's quite difficult. It may be the kind of people we are taking. So I think I am concerned with the number of leaders that I see among the people that I work. It's something that really concerns me. And I see a lot of, the classic example I have is we employ a lot of people, and recently what we've seen is the BMS doctors whom we employ, they are willing to work extremely hard, whereas today's MBBS doctors are extremely entitled, and that's a seriously big problem. But these guys will become postgraduates and then hopefully consultants. The other thing that Dr. Ram brought about was selfless leadership, and somebody called it what I would say is servant leadership, and that's something important. I strongly believe a leader should put his team ahead of him, or the interests of his team ahead of him. And some of the word that comes to mind is quite often a leader has to sacrifice his own interests for the interests of his team and for the interest of his organization. And that's something that a lot of people are not willing to do. I think Ram sir very clearly alluded to the fact that you have to be able to put others' interests ahead of you. And that's something that, I'm very fortunate I learned from my own father. So I remember him every day. So this is what I believe is what I have learned over the last few years. It's been an extremely amazing journey. We've just finished 5 years at Prakriya Hospital a couple of days ago, and the learning has been amazing. And I do not 1 minute repent for what we have, the different journey that I've taken. And we hope that the small little impact that we have made in the community over the last 5 years will grow over the years as the hospital gets bigger and busier. Thank you very much, Vidya, and thank you, everyone.
Ravi, you have your hand up. Goody.
Yeah, thanks. Let me put my hand down. Thank you so much. First of all, I want to say that it's lovely to see Vani and Ram. They look very similar to what I remember them as our seniors back in when we were in JIPMA. My personal thing, I mean, and I have a slightly different point of view, frame shift, if you will, because I work as a scientist in pharma. And one of the things that I find very annoying is this lack of promoting other people. Leaders, and actually I see it quite a bit in academia as well. The many examples, even from from PGI, where I did my residency, where a lot of the guides who guide MD theses and other things become the first authors in papers that have come out of their students' MD thesis, which is really not good leadership, particularly in terms of promoting other people. And I think that not enough emphasis is placed on that. Most leaders don't seem to be aware that that is an extremely important aspect of their job. I just want to know, comments about that and see how people actually, how can leaders be trained to promote other people?
Right. Yeah. Thank you for that, for the comment. The thing is, you talk about your publication and publish or perish principle, basically. Unfortunately, I think the plot is getting thicker and thicker as we go along. And there were days when, if I'm head of the department, my name appears as the first name in every paper that is presented by the department. Now, those days are gone. And fortunately, I think, the rules are becoming stricter. And we really need to make sure that only those who have contributed to a research project find their names into the paper. But I do agree that in earlier days it was not so strict. And there are people who, if you look at their CV, it will be a 50-page CV, out of which 35 pages will be their publications, and half of them they wouldn't even have read, right? So we know that getting your name to a publication, you need to deserve for your name to be there. And unless you've done adequate work on that topic, I think your name should not be there. So research is one of the three things that I think any medical doctor does. I have put it down as one of the points, but I didn't bring it up for discussion. All doctors need to be good clinicians, without doubt. Okay, doctors who wish to work in an institution need to be good teachers as well. And those who wish to continue teaching in an institution need to be good at research as well. Otherwise, they'll be chucked out very soon. Right. So I think all these three aspects are important. And research, how to promote it. Unfortunately, I don't have the answer, because now I find the tendency is for any institution to emphasize more and more workload to be taken by the clinician rather than spending time on research. So unless you are purely into dedicated research, I don't think we can really come out with good quality research. I don't know whether I have answered your question directly or indirectly, but that's what I have to say.
one question. I mean, Dr. Venkatesh is not in the call anymore, but he had an interesting last question. What should be the legacy of those in leadership positions?
Okay, I think one of the speakers had said earlier, that the legacy you need, is when you are no longer the picture. If the department, if you can, go, what should I say, as an invisible person to the department, and you find that the department is running with the same kind of, principles that you had set up, then I think that is very satisfying for any leader. So how do you reach that position? Everybody who is going to be in a leadership position in the future needs to understand that this department believes in this, this, and this. These are the qualities that we emphasize. And unless the subsequent leaders take up that as their primary, modes of functioning, then you will never create that legacy. Like, for example, I go back to my own example. When I took over from Dr. Tota, I thought it was a huge legacy that he had left behind. And I thought I'll never fill his huge boots, right? But I think as we move along, I didn't do too bad a job, though I say it myself. It was very difficult for me to emulate Dr. Tota's level of efficiency, but I did manage to some extent. And that way, his legacy was continued. Now, if now somebody looks at my department, which I left 7 years ago, and some of the principles are still there that we had taught, then that's a good legacy you left behind. Right. So I think you need to emphasize, you need to make people internalize. People who get into leadership positions need to internalize the qualities that you want to emphasize, and only then your legacy will continue.
Yeah, thanks, Ram. Radhakrishna, we are almost out of time.
You mean to say I should wind it up?
No,
See,
I said your turn has come at last.
All right, it means to say there's the last one. Yeah, actually, when I asked Dr. Nandi, Samra Nandi, my mentor some time ago as to what is his biggest achievement, he said, my students who are leaders around the world, I think as Dr. Ram was commenting on, that leaders make leaders and leaders don't make followers. That's a brilliant example. And also the point that, you should lead by example, like Imran Khan and Kapil Dev. I mean, that's the truth, that you should be good in what you do. You should be the best and you should be a leader. Because there's so many very good players who can't be leaders or captains, whatever. But the thing that worries me, as Dr. Sonath was commenting on, you have less leaders and more non-leaders coming out of medical schools. I do not know why as time goes on. I mean, is it because, or is it the fact that leaders are born and not made, which is a huge discussion all the way? And things that worry me is to how to deal with insubordination, because when do you identify that there's insubordination and how to deal with it? Because I'm sure most leaders will face it and there's a way to do it. And the final point I want to comment on is that I'm working in corporate sector. Most leaders don't want to hang their boots, and they don't want to make way for the immediate next. And when should a leader realize that his time is up and it's time to give to the next person?
So, yeah, but do you want me to respond to some of these things?
Yes.
Yeah. So you brought up a lot of points. So I'll go in reverse order. I'm on the wrong side of 70. I'm going to be 70. So let's repeat all your questions. Okay. So the last thing that that you said was, when do you know it's time for you to leave? Right. So I think I remember again, it was again a famous cricketer who said that you should leave whatever you're doing at a time when people will ask you, why is this person leaving now? Rather than, why is this person not leaving? For God's sake, why isn't he leaving? Right? So the time is right for you to leave when you are at the peak of your profession. Though it's a very difficult decision to take. When you're at the peak of your profession, you want to go that extra mile. You want to know whether you can do any better. Right? So you don't think it's an appropriate moment to leave. But I think you should leave at the peak of your career when you think you found a proper deputy. Luckily for us nowadays, there's a rotating headship principle in most institutions. So your time's up. They tell you next year you're no longer head of the department, so you have to find a deputy by then. So it becomes a time, regulated leadership. go back to your other questions.
One is insubordination. How do you identify this insubordination? How to deal with it? Because it's something which all leaders face. Somebody is not listening to you.
Uh, Again, I think you have to take it bit by bit. Somebody who doesn't want to eat the entire pie at the same time, you have to give it piece by piece, right? So take him or her into confidence. Try to say, this is what I think would be a better if you change your attitude. This will be better. You can also say, truthfully, if some people have come back to you with some comments about this particular person, you can say that without mentioning names, X or Y was talking about you like this, and I think it's not a good good what should I say, quality for you to have. If you change your ways, you're going to become a better person. So take it bit by bit. You cannot bring about change overnight, but I think if you try hard, you can even polish the most difficult gem, right?
The other one is leaders are born and not made. And why is it that not many leaders come out of medical schools?
No, I said a similar statement to Dr. Krishna Rao, who I mentioned in my talk earlier. I said, sir, are teachers born or are teachers made? So he told me it's a bit of both. You have to have a flair in you to be a teacher. And then if you listen to people who are good teachers and take in their advice, then you become a good teacher yourself. And I think the same rule can be applied to a leader as well. You have to have some qualities. You can't pick up anybody from the department and make him a leader overnight. Okay, that is why this question of identifying the person, grooming them to become a leader becomes very important. So they have to have certain qualities. But I definitely learned on the job. When I took over as head of the department on the 1st of July 1995, I was a very crude leader. I did make my mistakes. But over the next year or two, I made mistakes and learned that these are not good things for me to do. I need to correct these things. And I learned from my own mistakes. And as long as you're willing to do that, and you're willing to listen to, as I said, you have a person or a number of people within your group who are good advisors, listen to them and make the change. I think you can actually create good leaders out of people who are good quality clay to become leaders. They are modeling clay after all, and you can define and devise them into become very good leaders. And what's the corollary to this question?
I mean, that's all.
No, I thought actually, Patta, I thought you're summarizing with all your points. I was not listening very carefully. I didn't realize
No. Of course, the one I started with my boss's comment that
surgeons always give trouble, Patta.
his biggest achievement.
Surgeons actually always trouble anesthesiologists, right?
His biggest achievements is that he's created so many leaders, as you rightly say, leaders make leaders, and that's a wonderful thing. And it's a lovely watching both of you in one screen and listening to it. So it's really, really wonderful and very thought provoking. Thank you, sir.
Vani has been my confidant outside the department. And very often
there's no insubordination, I presume.
No. We are 50-50 right from the beginning,
Actually, I think there have been a lot of questions about conflict resolution. I'm not sure. I thought we did a session on that.
Vidya, can I interrupt you?
Yeah.
Can you save all the chat? You can, right?
Yes.
Yes.
Also gets saved. That also
yes, it gets saved.
I'd like to see that because I was concentrating on listening to the questions and answering them. I'd like to see some of the questions that may have been left unanswered. Somewhere in the chat, my email ID is also there. So there is something, some people asked me to share the name of the book that I was talking about. I'll do so on the email. If you write to me, my email is rvenkateswaran@gmail.com. It is there on the chat. And so you please write to me and I'll be quite happy to share the name of that book with you. In fact, that book was so good that I ran it as a weekly session for my staff so that all the staff members start thinking the same way. I actually photocopied chapter after chapter at my own expense, of course, and gave it to all the 36 staff members and said, please read this chapter and come next week. First week, 36 members came. Second week, it came down to about 12. Third week, it came down to about 8. And then fourth and fifth week, it became single digits. And after that, it dwindled out. Right. So I realized that there are not too many people who want to be leaders in the department. Right. The writing was very clear for me.
Woody, there's no H. Yes, I think you got the spelling right. Giri. Sorry. So Sundari has a final comment saying, acknowledge, apologize, amend, and appreciate as part of conflict resolution. So anyway, the among all the points to take home, one thing I realized today is that we need another session on conflict resolution. So we'll be coming up soon in the coming weeks on that, because that seems to have both conflict resolution as a leader and conflict resolution as a team member, whatever. Your closing comments, Dr. Rajan.
Yeah, I find myself really learning a lot with every word that people are contributing. And it kind of surprised me as to how much I've gone through leadership without realizing I was doing all these things. So it is a little wake up call to know that I have been on the right track most of the time, and I could have done things better if I get the chance again. The little comment that I have to make is that, Ram, we never spoke about leadership versus management. And one of the problems that we have in corporate sectors is this management sitting with a bigger eye on you as a team leader and expecting you to perform. And that answers go back to the Dr. Patta's question is why no new leaders are coming is because they are seeing their leaders being suppressed by management, which is not a very nice thing. And no leadership is ever rewarded within the institution. You may get your awards in your societies and other things, but within the institution to get recognition and reward is not that easy. And when juniors see that this is happening, they say, hey, why should we, man? We'll do our job and go and let somebody else take the burden. Thank you, Dr. Vidya, for allowing me to be part of this program. As I said, I've gained a lot, and I appreciate the large audience of more than 100 people who logged in. And Ram and Vani, thank you. I hope this ignites the friendship again, and we meet more and more, not on screens, but in person, and preferably with a small shot of scotch or something like that would be. Okay.
Thank you, Dr. Rajan. You brought up the points that Dr. Raghava Koneru was saying. He said, there's people confused between leaders, managers, and manipulators. And obviously, Ram is, not gone in that direction of what manipulators are, the current set of leadership sometimes in the corporate sector. We'll talk about the good side of leadership and managers, like you said. And Ram, do you think that Shivam also mentioned about organizational leadership versus strategic leadership? So do you think even your talk focused mainly about being running your department or whatever, do you think the doctors need to take the step and get out and actually be healthcare managers? Is that where the future is, and is that likely to have more takers than team leaders?
I wish you had not asked this question at the closing moment, because it's going to open up a Pandora's box. Because I always feel that you're a good clinician, you're a good leader, you're good at that. But I find a lot of my younger colleagues in other departments, not necessarily in anesthesia, but definitely in other departments, are now doing MBA programs, and they want to leave clinical medicine and become administrators. So probably they feel that it's easier to wield the whip than to receive the whiplashes, which I think is a wrong way to go about things. Already we are depleted. We do not have too many good leaders, as mentioned earlier, and I think we are running away from the truth if we actually start doing that. It may be more lucrative to become an administrator. You don't have to strictly stick to clinical timings. You don't have to go at 12 o'clock in the night and administer anesthesia for a case or do a laparotomy or whatever. You will have fixed hours of the day, and you can wield the whip as you wish, right? So a lot of people are doing that. But I don't think that's justice. Then you shouldn't have taken medicine in the first place. You should have gone into administration straight away. Because after becoming a medical doctor, then you are actually giving up the race. I feel that you're now giving up the race because you don't feel comfortable, because somebody else is now calling the shots.
I disagree with you, Ram.
Absolutely, yeah. You can.
No, I think what she's asking is, should doctors become? You always say that the MBAs who come, the non-doctors are jokers. You tell me over dinner. So she's saying, if doctors take up administrative role, will things get better?
I don't think it's right, because the very fact that they're running away from medicine, which was their first choice. I mean, this is my take on it. Okay, everybody will have an opinion on this, I'm sure. But if you've taken up medicine, it's because you're very passionate about it, right? Like you were and like I was. All of us became doctors because somebody was there. As you said, Rajan's dad was your role model. You had got Dr. K. Sanjeevi, who was also another role model, right? I became a doctor by accident. That's a different story. But I didn't have a role model to become a doctor. But I became a doctor because I was the fifth child in the family and nobody had done medicine till then. So they said, you become a doctor, and I became a doctor. So that's a different story altogether. But I think once you become a doctor and you're passionate about it, it's not right to flee the sinking ship. If you feel that we need people in leadership positions, in departments, in medical schools, I think we need to stick to that rather than go into a different field altogether. I don't think.
Vidya, if I can summarize Dr. Ram's words in undiplomatic terms, failed clinicians become administrators, and there will be failed administrators too.
I didn't say that, Patta.
You can not in as many words.
Take the blame for once here.
Somebody's hand is up, but I cannot identify, but their audio is not on and name is not coming up.
Anything the audio says, yes.
Somebody's hand is up. So. Giri, did you want to say something? Your camera is on.
No, that's what everybody doesn't. Can you hear me?
Yes.
Everybody doesn't get inspired to become a doctor. I actually joined an engineering college. After 3-4 weeks, my dad said the same reason. Nobody in the family is a doctor. Go and join Chipmar second list had come out. It's by accident. But I'm happy. Not that I'm not happy.
How good an administrator are you, Giri?
You should ask my people here. You come to Warangal, stay with me for a day, and I'll take leave the next day. You can ask.
As long as they don't beat me up, that's okay.
So, Giri, where do you practice, yeah, as an ophthalmologist?
At Warangal. Warangal is about 3 hours journey from Hyderabad. It's a government medical college.
Somebody put up a comment about examiners, and I think, thankfully, I've done quite a big round of India as an examiner. But Warangal is one place that I missed.
So, you need not become an examiner to visit Warangal, sir.
No, I'll come. Now that I know you're there, I'll come. This thing.
Vidya and Radhakrishna both have my number and their address. Vidya has
I'm sure you know the apple of your dad's eye.
Huh?
Apple of your dad's eye, having become.
I think he actually passed away last year. So
but I'm sure he knew you're an ophthalmologist.
Yeah. Thank you.
Thank you everybody for that wonderful interactive session. And like everyone mentioned, we had more than 100 people logging in today. And even after some people left, there were still about 100 there. So it's evident that people are interested. There is a buzz about leadership, and people are keen to hear what Ram had to say. Thank you, Ram, for taking the time and doing this session and patiently answering everybody's questions and taking all comments in your usual sporting way. Thank you, Dr. Rajan, for readily accepting to moderate this session. I hope you had a good time. We'll meet again next week with another episode of Marvelous Medicine. Till then, take care and stay safe. Good night. Oh, iPhone finally has their hand up. If you have your hand up and want to say something, please go ahead. Your name is showing up as iPhone.
iPhone. Yes.
No, I think the person can't hear me.
So, Vidya,
yeah.
Before we sign off, I'd like to thank Vani for being my quality control manager.
That's a good one.
Everyone needs a quality control in our lives. Like Radha Krishna also knows. Good night, everybody. See you next week.
Good night. Thank you. Thank you.
Thank you.
Thank you.
Thanks, everybody. We'll sign off. Thank you. Bye.
Thank you.
Bye.